To measure hip extension, the patient is placed prone on the table. The goniometer is placed on the lateral side of the hip. The axis is lined up with the greater trochanter, which is right here. All right. The stationary arm is simply lined up horizontal along with the trunk. And the moving arm is lined up with the lateral epicondyle of the femur. You'll notice the feet are hanging off the end of the mat to allow for a neutral position of the hip. That's the starting position. Ending position is simply the leg elevated up in the air, keeping the knee straight as you do it to keep the quadriceps on slack so you don't get any passive insufficiency issues there. Again, the axis is over the greater trochanter. Stationary arm is straight. Moving arm is lined up with the lateral epicondyle. There you go. And in that case, we have only about 10 degrees of hip extension in this case. One of the things you want to make sure of is that you don't get substitution with rotation of the trunk to make it look like they're getting more hip extension, or simply anterior pelvic tilt to make it look like they're getting more hip extension than they actually are.